Julie and I and Bella miss seeing you, probably more than you know, but God knows you've been on my mind a lot, and you're in my thoughts and prayers every single day. And I hope everyone is staying safe and healthy. And I'm glad that you're here today. And we're hoping to just kind of reconnect and get some updates from some of your classmates that are kind of on the front line, and kind of maybe have some discussion about what's going on. So I do want to just give a couple updates about, your class will go down in history as the only class that, survived a pandemic. You're so sorry that the last session had to be canceled and graduation, but we know that we're gonna make it up as soon as we can, and we'll have the best graduation party ever. I promise you that. So we had to make some tough decisions with our board, and we decided to cancel our junior program for this year. That would have started in July, and I don't think we'd even be able to find a venue that could host us. So we're not going to have a junior Leadership Macomb program this year. We're still taking applications, and anyone that applies this year would kind of be an automatic for next year. So next year would be a combined class for juniors and seniors. And then as far as our next Leadership Macomb class, this would be our recruiting time right now to get people for the next class. And we're still trying to do that. We're still, we have, like all you guys, I'm sure, have a plan A, a plan B, a plan C, D, E, F. So our plan A is that, we can continue with another class in September, just like usual. And then our plan B would be that we wait and start in January. And then our plan C is just to shoot ourselves in the head. I don't know. I don't know. We've
don't do that.
Thinking about some different things, but hopefully we'll get back to normal, either with the September start or January start. And as soon as I know more, I will let you guys know so that you can maybe help with the recruiting process for the next class. And Bella and Julie and I have been working remotely like most of you have. Although Julie and I are brave now, so we're coming into the office once a week, but we're like in different rooms, so we are social distancing. And what else? Anything else? Julie, did you want to add anything as far as updates?
We just feel bad about like your class not ending, like Karen said, because you guys know it's all experiential. So to do a Zoom from the courts, it's very different. Like how to get that experience of actually going into the jail and seeing it is just so unique to us. So that's why we're really having we feel bad for you guys, and then how do we move forward where somebody still is going to get a similar experience every year with that experiential piece. So that's kind of where we're struggling with right now. So just kind of trying to be creative, but at the same time, we know everybody's on Zoom all the time now. So it's, how many movie rooms and kids' pictures can you see? You know what I mean? So just different and just hard right now.
Yeah, we've been in contact. There's hundreds of leadership organizations like ours throughout the country, and everyone's kind of going through the same thing. And even locally, Leadership Oakland, Leadership Detroit, we're all struggling with how to get through this. And the jury is still out. Leadership Oakland, I think, is going to be moving to more of the virtual learning, which I'm not really a fan of, because like Julie said, our stuff is so experiential. You have to really kind of be in person to experience it and to meet the people and see what's going on. So I'd rather kind of just hold off and do that. Plus, who's going to pay tuition to sit, in front of a computer screen for 8 hours? And it just isn't the same. So
plus you guys already have formed that bond, so at least you can still be in contact. You guys have each other's information. You know what I mean? Like to have a brand new class come in, and that networking piece is so important too. And
Yeah.
I think just I told Karen, I was like, I come into work once a week and I get so much work done. And I feel so much more creative thinking about this stuff than when I'm at home trying to like, you balance, your kids and dinner and laundry and all this stuff is like vying for your attention. It's just very different. So you don't want to give up any of that creativity either. When you're sitting at home, you're like stressed out about other things because you're at home. So I don't know.
Yeah. So anyways, that's kind of our update, but we thought, geez, we have such an interesting class composition. It would be great to get a few of you to talk about what you've been experiencing over the past 9 weeks. So is Chris on? Chris Bissell? He's not.
Yeah.
Okay, maybe he's not here yet. Danielle, did you want to talk a little bit about what you guys have been experiencing at Henry Ford over these 9 weeks? Because there's so much information out there, and man, I think unless you're in the front lines, you just don't know what to believe or what's true or what. So any insight you could give us would be very helpful.
Yeah, can you hear me okay?
Yes.
Yeah. Okay, good. Yeah, this last 9 weeks have been an adventure, to say the least. Where we are today is much different than where we were even 3 weeks ago, or even 2 weeks ago. So it has been a rapid cycle test every single day since pretty much March 11th, when we first got, the indication that we had COVID patients in the state of Michigan. And then, as we all know, March 13th kicked off as a day where everything changed. Schools closed and social distancing became a must-have, and those kind of things. I throughout the course of this, I watched the news, and then I haven't watched the news. I could always tell when there was something out there, either in social media or the news, because all of a sudden my family from across the country would start texting me, how are things going? So, or friends in the area wondering how things were going. I know a lot of what I heard is like the PPE shortages that we all heard. And I have to say, seeing the community come together during this time has been just amazing. There is no healthcare worker that's starving, I can tell you that. We get just so many donations, not only from businesses that are feeding our frontline teams, but from even just community members that are at home making homemade masks and bringing them into our hospital clinics. I mean, the overwhelming support has been such that we've had to set up donation centers because it was overwhelming our supply chain, which was already a pretty busy function at the moment. But we had a lot of confusion from the public on, well, how are you having a shortage of masks when we're donating things? And, hair salons were donating masks that they weren't no longer using. And there's just so much behind the scenes that goes with that. I can tell you when we first started, so the beginning of March, our supply for PPE the current supply we had on hand would probably last us 2 months without getting any additional shipments. Well, when COVID hit, the burn rate for our PPE went through the roof. Our COVID patients and the amount of PPE and how often we had to change it was causing us to go through thousands of masks and gowns a day. So a supply that would have lasted our hospital 2 months without any additional shipments now was only lasting us maybe 2 days. And what was happening, the supply chain for across the country became so taxed that we weren't getting the normal shipments that we were once getting, and then we were burning through it way too fast. And so there was a lot of, seems like a confusion that was coming through the media and why we were having these PPE shortages, and it was hard for folks to understand it. But there was just so much in it too. Like, for instance, we were getting masks that people had in their garages for 5 years, like N95 masks, and that was a hot commodity in the early weeks. And they were bringing us their masks that they had in their workshops. And we can't just put those kind of masks on healthcare workers. They have to be properly fit tested, or they really can pose more of a risk to the healthcare worker than they do a benefit. So we're at a good place now. You know, we have a good handle on what's happening, and we have a better understanding what's happening, and how to better take care of our COVID patients. You know, it was something that had we had even a month to prepare for, a little bit better, we would have been in a more prepared state. But I can tell you, I'm very impressed with Henry Ford and how they handled it, and the different things that we've had to employ and put in place. You know, our scarce resource plan has been in place for many, many years. So we were able to bring that up and really put it to action and put it through a true test through the last 9 weeks. And, you know, we've done well with what we had. Things like even just space. I mean, it takes so many different areas for healthcare to function. And it really brought that into perspective the last 9 weeks. For instance, funeral homes shut down. And so our morgue spaces became overwhelmed. And in most typical hospitals, morgue space only has the capacity for maybe 5 to 6, you know, 5 to 6 human remains. Well, when you have funeral homes that are no longer accepting patients, we saw that as a huge vulnerability very early. And Henry Ford was extremely proactive. We ordered mobile trailers, morgue trailers to be prepared on the campus. So we didn't have to deal with some of the overflow issues that some of the other hospitals, unfortunately, were struggling with. And I know there was a lot on the media in regards to that, you know, and some different measures that different hospitals had to do. You know, we're fortunate here at Henry Ford. We had thought of some of those plans long before we came to that point. But really, I mean, it was a true disaster at its test, and brought every emergency management plan that we had out. We were going through it. You know, unfortunately, some of those things got leaked to the media too, which it's hard when those things get leaked and you don't have the ability to explain the here and why on why it exists. And there was a letter that went out from one of our emergency management plan and how we allocate scarce resources in a time of disaster. And it was a letter that can be just very upsetting. And it's upsetting for anybody to have to even develop a plan like that. But, you know, we had to think long ahead of this of worst case scenarios and what that would look like and how we would handle that. So when it came to that point in time, we were dealing with a well thought through process and not dealing with the immediate threat or the immediate disaster. So one of those letters got leaked to the media, but that was a tier 3, a triage level 3 letter. We fortunately never got anywhere close to that level of need in our emergency management plan. In fact, we stayed very, very well into a triage level 1. We started to kind of dabble with what a 2 was looking like, and we still have little pockets of where we're practicing those allocation of scarce resources, but for the most part, we've been able to manage and really redefine how we do healthcare. I mean, in all honesty, to summarize what we've been through in the last 9 weeks, we have completely redefined how we deliver safe and effective care to patients, both COVID patients and non-COVID patients. For instance, you know, when we had to start reusing masks to keep our healthcare workers safe and making sure that they had appropriate PPE, Henry Ford developed a process to use UV lights to start decontaminating the mask. So now we're able to use them up to 5 times safely by using this UV process. Swabs and testing, that's been another challenge. You know, we all want to open up testing across the state, but we don't have the resources and the space to do it. So in our testing centers they were bogged down with the amount of demand there was. So Henry Ford was the first in the state to get their own testing program up and going. When we first started it weeks and weeks ago, we could only result 50 specimens a day. Now we're up to over 1,000 specimens a day we're able to process on our own independently and not having to rely on some of our other testing locations. Swabs became an issue for testing patients. So our innovation center downtown started making nasopharyngeal swabs out of 3D printing for us. So the car companies, you know, they've well, not just the car companies, but also the suppliers making us masks that we're able to test and make sure that they're healthcare grade and really keeping our patients safe. We've, you know, worked with various manufacturing companies to meet our needs. You know, unfortunately, the GM is now building ventilators, but we're fortunate to be, because of our strict stay-at-home measures, we're fortunate that we no longer need the amount of ventilators that we did at one time. Tesla came through and donated BiPAP machines to us that we were able to convert to ventilators and use on patients. So, you know, Henry Ford really had to reinvent how we were doing things, and we had to look around and see what we had available and how we could modify it to make it work for our needs and be able to take care of patients. So all of our BiPAP machines in the health system, we were able to convert to ventilators, as well as our anesthesia machines. And so when we needed those, we looked at within first and looked at our community partners to help us out too. As you know, financially, it's been a challenge, I think, for every single industry. I don't think there is an industry really unscathed from the last 9 weeks of this, and healthcare is definitely no exception. We're fortunate to have some programs that are helping subsidize, but it's certainly not going to cover the entire cost that you know, the health systems have endured over this period of time. It's just nothing that we planned for, and it was incredibly and is incredibly expensive. You know, the COVID patients that we have in the hospital, they're very sick and they require a lot of resources. And even just simple things to take care of them, we've had to change, such as IVs. You know, we've had nurses were going through so much PPE going in and out of rooms that we developed IV tubing that keeps the IV pump outside of the room, so they can change the IV bags and stuff without having to, you know, get a full PPE on and go into the patient's rooms and those kind of things. And it's hard. The patients that we've had in the hospital have been very, very sick. You know, and they require a lot of resource to get better. But we are really taking pride in celebrating the successes through this. The patients that are successfully weaned from the ventilator to the patients that are able to be discharged. I don't know if you guys saw on social media, you know, we use the song Don't Stop Believing by Journey when a patient's discharged, and we truly celebrate those. And two of the original band members reached out to our own Bob Riney, our CEO of the hospital, to say thank you for using their song, and they felt just really proud because that song was meant to be a message of hope. So those kind of things have been very, very uplifting. You know, just the amount of support. We have a parade today at 3 p.m. at our hospital with our first responders. They're coming through to celebrate healthcare workers, but in turn, we're celebrating them. You know, we're all very, very, very happy to have the team of community that we have. So we have our healthcare workers are making signs and an appreciation for them as well. So it's been a challenging time, but we're getting through it, and you know, I think we're going to be better for it as a healthcare community.
Thank you, Danielle. That, you know, it is so encouraging to see the community pull together, and you know, maybe we'll see if there's some questions after. I just want to make sure everyone gets a chance to talk. Chris, is there anything you wanted to add from the Henry Ford side?
No, I want to record everything that Danielle just said.
I know, it was great, wasn't it?
No, absolutely. She did a wonderful job really kind of explaining how things happened and how they unfolded, how we were impacted, how we were challenged to really think differently. And I think, you know, the phase that we're in right now, calling it, you know, recovery, if you will, where we're coming back out of this. Because another thing that people don't understand is we had to shut down, you know, considerable amount of our business. And so surgery, for example, was pretty much shut down. Radiology services shut down. A lot of the primary care offices, for the most part, shut down. And what we did to make sure we had the appropriate PPE is we went into these offices and these big, you know, medical centers and actually pulled hand sanitizer from those areas and PPE from those areas, and really to urgently get it back to the hospital. So now we have to go through a process of actually reopening all of those centers, in Macomb County, obviously, but across southeastern Michigan for Henry Ford. And so it's a very methodical process of making sure that all of those areas are well equipped with what they had pre-COVID, but also more importantly, what do they need now post-COVID? And how is that going to change the delivery of care? We've done a lot with virtual technology and doing video visits with a lot of our patients, which has been phenomenal. But how do we rethink that so we don't have as many people coming into the office anymore, which is great because that helps us with social distancing. How do we look at expanded hours to potentially help those patients that didn't come in during the peak of this? So really rethinking, Saturday, Sunday hours, extended hours, treatment protocols, you name it. We are pretty much reinventing all of the things that we've done for 100 years. So it's been a lot of work, but I agree with Danelle that, we're very proud and excited about, the new healthcare that's emerging from this. And, I think the biggest part right now is helping the community understand that we're, as a health facility and a healthcare organization, we are here for them and we're safe. Because there's unfortunately a lot of stories of people that, were either misdiagnosed, because we were so focused on COVID and they had COVID symptoms and maybe they tested negative and they were just told to go home and isolate, and maybe there was an underlying issue there. And so we're starting to see some of that as people are returning or coming through our ER. So we want to make sure that people aren't avoiding care. And that's what we've seen it. So we're trying to make sure that, we are ready and able to treat them when they're able and safe to come in. We actually just completed a large system survey. I think we had about 2,500 to 3,000 respondents. And one of the things that was very eye-opening is the community's perception with, when is it safe to come back into the healthcare center? And most of them said, not right now. Probably 30 to 40% said, I'm not ready to go back in now. And it might be another month or two, which really, had us rethinking about, okay, so how do we take this fear and the anxiety, and how do we maybe use some of our non-traditional areas to be able to care for these patients, to avoid them having to come into a large hospital where a lot of different patients are coming in and coming out. We've restricted our visitor policy tremendously, and that's helped to kind of limit the amount of people coming out. But how do we utilize our smaller ambulatory sites to provide an environment that is safe and it's more comforting to the patients as they come in? So it gives you a little bit. I think it'd be great if anybody has any additional questions, I'd love to answer them.
Does anyone have any questions for Danelle or Chris? I know Julie was supposed to be on from Beaumont, but she's having a hard time getting connected. So any questions for Danelle or Chris?
Yeah. I have a lot of questions, and I'm sure medical professionals would be able to give a better answer than what we're hearing on the news. But I'm hearing that this winter will be really, really rough because COVID will come back and attack those who have once recovered before. I've never considered COVID patients. Can you speak to some of these myths or things that we're hearing in the news? Can you speak to some of that?
Sure. Chris, do you want me to speak on that?
Yeah, no, I think it'd be good.
Yeah, so one of the concerns that you might be picking up in the media, in the healthcare world, one thing that we are starting to plan right now, even though it's vastly early, but we feel we need that lead time, is flu season. So come this upcoming flu season, I mean, there's going to be a huge push for people to get flu shots this year, more than ever before, even more than the H1N1 pandemic that we experienced years ago, because the risk of having these two illnesses in the community that mirror each other, they have similar presentation, and being able to discern, because the treatments are different and how we handle those may be different, that's going to be a huge concern. There was a study that came out of Stanford about co-infections that they found. We are very, very fortunate in Michigan that when COVID really hit us and we started to see the peak of it, our flu season was ending. So we didn't experience a full flu season and COVID on top of each other. Unfortunately, as the fall comes around and flu season comes back, there is a likely possibility that we will be dealing with both these infections at the same time. And there could be a co-infection rate where people not only are influenza positive, but are also COVID positive. And what does that mean? And how does their recovery time look, you know, if that does occur? So that is a real concern that we have. We're preparing for it now. But it's going to be, there's going to be a huge push for folks to do what they can. And one of the things that we can do is try and help prevent the spread of influenza on top of it by getting flu shots and things like that.
Thank you. Thanks, Danielle. I want to make sure that that Paul and Luke and Lisa get a chance to talk. So Luke, from the EMS standpoint, what have you guys been going through? You know, we're hearing things in the media that the EMS providers have been inundated picking up dead bodies from homes and things like that. Can you kind of fill us in?
Yes, I mean, just briefly go begin. We saw this, the March 11th, some of the first confirmed cases. Even though it had been discussed in other parts of the world, there really was a increased concern, and the problem is during that everybody getting inundated with, wow, it's here, it's real, it's growing, was and processes and procedures that we thought were sufficient turned out not to be very sufficient. So then I'll talk about PPE, same thing for EMS. We have been, in my life, and it's not a short lifetime, had anything like this. We planned for that protective equipment for a certain amount of use, and an agency an ambulance service would keep around is even a small fraction of what a hospital would. What would have been years worth of supplies for EMS was a matter of weeks. We also, what we call the worried well. We had a tremendous increase in EMS responses for patients who were worried they were very sick and they weren't very sick. Early on, to what we call some initial phases of what's called crisis standards of care, where you can't do business like you normally do business. And hospitals were forced to do the same thing. Get into what we thought we might have to, very fortunately. Then I'll mention, the letter and their plans where, we do have to plan for the worst case scenario, and we didn't quite. I'll echo what Danielle said about the community stepping up. For PPE, as an example, Macomb Community College, across all of their campuses and all of their healthcare programs, donated of PPE that they owned. And my office actually became the clearinghouse. We initially were very much involved in distributing PPE that was coming from resources and regional resources. It was coming through my office, and we managed that for a week or two until emergency management and their program took that over. But now they're opening, they own no PPE, and there's a supply chain that is just still saturated and backlogged. So the community stepped up, Macomb Community College stepped up all of it. So not only did we see a very sharp increase in run volume for people who were very worried they were sick or had some very mild amount of symptoms, task time dramatic. It takes a long time to put on a full set of PPE, go in, assess your patient, do what you need to do, and then get out of your PPE. So increased task time really put a strain on the EMS system initially. PPE supplies were an issue. Like I said, we had all these different agencies who were trying to assume some level of responsibility for things like PPE and procedures. We had local emergency management, we have the state, we had federal resources, we had what's called our healthcare coalition. We're a network of hospitals, public health. We're figuring how can we manage this And I can tell you in the initial stages of that, that created some confusion. Not everybody was on the same page. And we have since we put together a process and a plan for those agencies to work together much, much better than they were initially. So right now, I think the more interesting or the more pressing matters, one is we talk about testing. We need to get into our congregate care facilities, our nursing homes, begin to use patients in our extended care facilities right now. But when you hear about COVID testing, one of the side pieces to that is what's called antibody testing. Looking at, have you been, then the question comes, do those antibodies, which normally in other disease processes protect you from future infection? What we don't know is how protective that really is. That's stuck on every day. So as much as we know, we still have some big questions moving forward, especially like it was mentioned as we move into flu season. What's going to our flu? Is it the flu? Is it influenza? Is it COVID? So there's a lot of things out there where the physicians, the researchers, the are what's happening now, but also beginning to plan for what's going to happen 1 month, 3 months, 6 months from now. I don't want to take up too much time. I will say, we talked about and picking bodies. We have seen a dramatic increase in people dying at home. The data is looking at like 40 to 60% more people are dying. Normally, their deaths would be involved in that process. People are simply afraid to call 911 and afraid to go to the hospital. They are ignoring chronic health conditions. They're ignoring acute. They're ignoring. They are afraid to call family to tell them they're having stroke-like symptoms. People are having what they think are chronic health issues, which find out really are probably initial complications from cancer. They're delaying treatment. So we're the EMS agent, as well as healthcare are really trying to do a lot, and you can help share that word. It is safe to call 911. It is safe to go to the hospital if you have a medical emergency out there, and we are seeing, unfortunately, a very sharp increase of people simply dying at home. I think that's about what I wanted to cover. If anybody has any questions.
Thank you. That's great information. Thank you for sharing that. And if we could all maybe try to get that message out as best as we can through our social media channels or whatever, that you can't ignore your symptoms. You need to get professional help. So that's really, really important. Julie?